Miss Adib, how common is it for women to come to you and complain about irregular bleeding or bleeding between periods?
So irregular bleeding is very common. In young women, it's normally related to mid-cycle ovulation. You can have a little bit of bleeding or discharge. Many young women on the pill can experience breakthrough bleeding if they're on the combined oral contraceptive. Very commonly, women on the mini pill can experience irregular bleeding. Other causes of bleeding between periods can be polyps arising from the lining of the womb, and these can cause irregular, erratic bleeding. In young women also we see that infections can cause bleeding between periods, so it's really important to have swab tests to see if there's an infection. There's antibiotics that are really effective at treating those.
So how do you determine what the cause or causes of that irregular bleeding are in a patient? What are there specific tests?
So if someone's having bleeding between periods, then you need to have a gynaecological examination, speculum examination to visualise the cervix, have a smear test taken to check there are no problems on the cervix, looking for polyps on the cervix that can cause bleeding, take vaginal swabs to check for infection. One would also want to do an ultrasound scan of the pelvis to look at the lining of the womb, see if there are polyps there. One would also be checking for fibroids that may be projecting into the womb that can cause bleeding, and also look at the ovaries, as sometimes ovarian cysts can cause irregular bleeding.
Right. Is that often accompanied by any form of pain or discomfort, or is the bleeding the main symptom?
That really depends on what's causing the bleeding. Mm-hmm. Some women have regular heavy periods. Mm-hmm. We see that quite commonly with fibroids. Large fibroids can cause both pain by pressure and also heavy periods. Mm. Conditions such as endometriosis classically cause quite a lot of pain, especially in the days leading up to the period, and sometimes women can have spotting at the same time, and that can be a cause of irregular bleeding. Older women can experience irregular bleeding, either more frequent bleeding or less frequent bleeding coming up towards the menopause. In these cases, it's important to know that there's nothing serious going on. Any bleeding that occurs after the menopause must always be reported to check there's what the cause is.
Mm-hmm. So at what point should a woman think, right, this is a nuisance, but maybe I should have that checked? When do you recommend to come for advice?
Either if it's very heavy bleeding, or if it's persistent. So if it's something that's not settling and it's irregular, then really you should go and see your doctor about those symptoms. Most women, if they're ovulating normally, will have a period around every 28 days or so. Most women don't usually have bleeding between periods, although some do. We don't know why that happens. Mm-hmm. So really, if it's persistent, or it's very heavy, or if it's accompanied by pain, then you really should get that checked out.
Right. And treatments?
Really depends on what's causing it.
Mm-hmm.
So polyps can very easily be removed. Infections can be treated with antibiotics. Right. Fibroids either with medical treatment or with surgery, depending on how large they are, what their location is, and what your desires are.
Right. Ms. Adib, thank you very much.
You're welcome.